South Carolina is now ground zero for the worst measles outbreak in the U.S. in more than 25 years. There are hundreds of cases and new infections that are spreading now beyond the state. Vaccination rates in parts of South Carolina falling below levels needed to stop measles from spreading. The virus is one of the most contagious in the world, and once it finds a pocket of unvaccinated people, it can move really fast. Public health officials say rising religious exemptions and misinformation are fueling this outbreak. The surge already spreading beyond South Carolina. Cases linked to this outbreak have been found in North Carolina, Ohio, California, and Washington state. There's also confirmed cases in at least a dozen other states. Experts are warning any community with low vaccination rates could be next. Babies too young to get vaccinated are among the most vulnerable. So are people with weakened immune systems who rely on community protection. Health officials say when vaccinations drop, these groups pay the price. Dr. Angela Rasmussen is with us now, a virologist and steering community member for the Save America movement. Good morning to you and thank you. What concerns you most about what we're seeing with this latest outbreak?
Well, what concerns me the most is not just what's happening in South Carolina, because as you just pointed out, Marni, vaccination uptake rates in the parts of South Carolina that are being affected have really plummeted in recent years. In some communities in South Carolina that are being affected, vaccination rates are as low as 20%. Now, normally you need a 95% vaccination uptake rate to stop the spread of measles in a population because it's a very contagious virus. So the situation that we're seeing in South Carolina is really an example of what happens when vaccination does decline and measles gets into that community. But what worries me most is not just the explosive outbreak in South Carolina. It's the fact that this vaccine disinformation that has reduced vaccine uptake rates in South Carolina has also reduced that uptake elsewhere in the United States. And one of the things that we are really trying to get out there at the Save America movement is that vaccination is really, really important, because if it does drop to these levels, then you are going to continue to see more and more ever increasing in size outbreaks of measles.
Dr. Rasmussen, can you further address vaccine misinformation? What concerns you the most, and what conversations are you having with people who believe that the vaccine is unsafe?
Yeah, I mean, this is the hugest problem, because right now what we have is a really unprecedented situation in terms of the disinformation that's being spread. And that is that it's being spread by the Secretary of the Department of Health and Human Services, Robert F. Kennedy Jr., and the health agencies that he runs. We have never had a circumstance before where the CDC is publishing misinformation, disinformation about the measles vaccine on its website, saying things that are absolutely, completely untrue. For example, that the measles vaccine can cause measles, that the measles vaccine causes most cases of measles, that there are treatments available as alternatives to the vaccine for measles, that measles is actually good for you, or that measles can cure cancer. None of these things are actually true. However, they continue to be said, and unfortunately, they are being said by official U.S. government agencies, websites, and public health officials. This is incredibly dangerous because it continues to discourage vaccine uptake, and it makes ever more people vulnerable to getting measles infections. And the fact is, the only way to prevent measles is the MMR vaccine. 2 doses of the MMR vaccine provides 97% protection against measles, and that is the only option for preventing it.
The unvaccinated, those with compromised immune system, babies who haven't yet been vaccinated are all vulnerable. What about those who have been vaccinated, parents of kids who have had at least 1 or both doses of the vaccine? What should they know?
So parents of kids who have had their kids vaccinated should feel a lot more comfortable knowing that, again, this vaccine is 97% effective. That means in the vast, vast majority of children who've received even 1 dose of the vaccine, they have really, really strong protection against getting measles virus at all. So people who have gotten at least 1 dose, but ideally both doses in the series, can feel confident that their families are protected from measles in 97 times out of 100.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.